Alright everyone, so this is a video about the clicking that I've been suffering from in my left knee for quite some time now, probably getting on a couple of months. As you will see in this video, my left knee clicks when it is flexed and comes out of flexion, so when I straighten my knee from a certain point. So we'll start with some simple squats. Start with my feet together and drop down into a full squat, an ATG, ass to grass, right down, very comfortable, and there's a click. Now I take my feet a little wider, and I'm going to try a couple positions, down, and click. So we'll try some more variations. Take my feet, bring my feet heels together, and so with externally rotated femurs, still clicking. Feet out wide, a little bit beyond hip width. Very comfy, I can sit here all day. Not really any pressure to speak of in my knees. And up I come. And click. Here I am externally rotated, bouncing around with my heels off the floor. That should, if there was a problem with the knee itself, it would put pressure on the knee joint. No pressure, fairly comfy, but I get the click. And it's always the left knee. It's never the right knee, it's always the left knee. Okay, now I'm going to demonstrate some lunges. So I'll drop down to a very short lunge, and there's a click. I'll just make an adjustment here, shifting the microphone so that it'll pick up the clicks a bit better. So we'll try it again. Starting from a short lunge, and you can see the knee is in full flexion, and click. Now if I take the lunge a little longer, go down, and up again, full click. Take the lunge a little longer, go down, and no click. Now most of my weight is on my back leg, my front leg, my left leg. No click. You'll notice that my knee doesn't go beyond a certain point of flexion. Now there's a click. I'll show it again. Go down, no click. Down, and there's a click because my knee was pushed a little forward. So there's a certain point, no click, no click, no click. Now I've come forward, so more of my weight, click, more of my weight is on my left knee and my knee is pushed further forward, so the angle of flexion is greater and I'm consistently producing clicks. If I bring it back, so I'm going straight down, the weight is distributed across both feet fairly evenly, and the angle of flexion is not as acute, and I don't get the click. Now I'll show that when I lie down and I flex and straighten, flex and extend my knee, I still get clicks if I'm really activating the muscles around my left femur. So if I kick up, although you may not hear it, I'm still getting clicking. There's still something going on there that's producing the clicks. If I manipulate my kneecap by pushing it either out or in or down or up, I can have some effect. And here you can hear very distinct clicking, even though I'm not bearing weight as such on that leg. And there's some more. For comparison, I use a strap and I use my arms to manually straighten the leg so that I move it through that range, but with minimal activation of the muscles of the leg. And when I do that, I do not get clicks. So there's something that happens when I use the muscles in above the knee, must be the quadriceps and the hamstrings, to extend the knee, that's producing the clicks. Now, interestingly, if I push my leg forward in that way, without much force, I don't get any click. But if I sort of kick forward, or in this case down, if I were standing up, I get very minimal clicks. So if I kick out in that way with some force, I seem to activate the muscle or muscles that are responsible for causing the knee to click. Now I'm demonstrating that I can sit, I can kneel all the way down, so I can put my bum on my heels, and I can lay my feet flat on the floor, and I can sit very comfortably there. So very comfortable, no problem, no pressure on my knee. I can even take my feet out wider to somewhat exaggerated internal rotation of the hip, and again, not really producing any noticeable pressure on the knee. There is some, I feel that there's something happening in the knee, but it's very, very minor. And here, although the lighting isn't very good for this purpose, my bum's not very far off the floor. And if I had a little block or cushion, I could sit in this position fairly comfortably, certainly without any discomfort in my knee, which is the focus of this investigation. See, into a squat, come back up, not much problem. Look at it from the other side. So just go from a kneel, plop back, up and back, stand up, and not much going on, but you still hear the click. So that's that. That is what's going on with my knee. If you have any ideas, please let me know. Be much obliged. I'd like to get to the bottom of this as soon as I can. Thank you.